We've got kind of a beast to face in this next hour, but the things we're going to emphasize, just like I said yesterday, is you're the front door to how these patients present. People who are in the primary patient care setting have these patients come in, and what we're hoping is that you'll leave today, what I'm hoping is you'll leave today with some tips for how you can identify these cases and just general strategies, knowing that nobody in this room, well, maybe, let's take a poll. How many in this room are molecular pathologists? That's right, not me either. So I'll kind of guide you through what I have learned over the years in AML, and it's the perfect disease, I think, for introducing all of us in pathology to the role that molecular genetics is playing in our practice. And we all know that's true, right? I'm sure the majority of you, just like me, are CAP members, right? You get the molecular case every month from the Association of Molecular Pathologists. So even our parent societies that guide our practice are encouraging us to get more and more comfortable with molecular pathology as it relates to our practice. So for AML, we're going to talk about strategies for recognition of AML, and I emphasized that yesterday. So much is in that incredibly inexpensive CBC. And just to get you going in the right direction, or at least to have a reasonable differential for what the blood is telling you and what differential diagnoses you're going to pursue. And we cannot avoid molecular genetics in the world of AML, but we're going to talk about that from a practical standpoint and from the standpoint of what we do in our molecular laboratories that guide diagnosis, prognosis, and treatment in AML. So we'll talk about the definition and epidemiology of AML, the key steps in the diagnosis, big emphasis on hematologic parameters and identification of blasts, what we do all the time. Then we'll dip our toes into conventional karyotype. That's been around for a long, long time, and I think we're all quite familiar with that. And that opened the door for the genetic era in AML was the initial conventional karyotype. And then on top of that, we'll have FISH and we'll have molecular. And we'll talk about the classification